Okay. Good morning to all our participants in the UK and good evening to all our participants in this part of the world. Thank you for joining today's BMCC Trade Webinar Series. We are glad to see that there is quite a lot of interest in this event, and we would also like to thank our partners and fellow chambers in the UK for supporting us in promoting this webinar. Today's topic will be COVID-19, pivots Malaysian healthcare industry, and my name is Samantha and I am a Trade and Engagement Manager at the BMCC. Today, we are pleased to collaborate with the Medical Device Authority Malaysia and also DKSH Malaysia. In today's session, our experts will be focusing on the impact of COVID-19 on policy and regulations, risk management, perspective from a local industry representing foreign pharmaceutical products and medical devices, opportunities for UK businesses, as well as measures for companies to take to be ready for the future post-COVID-19. So joining us today, we have Jennifer Lopez, Executive Director of the British Malaysian Chamber of Commerce, Engineer SASIKALA DEVI, Director of Policy, Code and Standard Division from the Medical Device Authority of Malaysia, and GERTRUDE TING, Head of Business Development of the Business Unit Healthcare at DKSH Malaysia. So, before I pass the session over to our speakers, just a note, if you have any questions to ask during the session, please submit your questions via the Q&A function and not the chat function. The speakers will then choose the question to answer during the Q&A session after the presentations. And without further ado, I would like to pass the session over to Jennifer. Jen, you're on mute.
Sorry about that. Thank you, Samantha. A very good morning to all our participants in the UK and good afternoon to those of you in ASEAN. Thank you for joining us. I'm not a subject matter expert in the healthcare, but however, I would just take this opportunity for the benefit of the audience in the UK to just give a quick overview about Malaysia, the impact of COVID-19, how is Malaysia coping, and then what is the role of BMCC. So I'll do it very quickly. So can we go to the next slide? The BMCC, for the UK audience and also to the Malaysian participants and our members are listening, we always want to be your business partner in Malaysia. So just a quick overview here. Malaysia, it is in the heart of Southeast Asia, one of the emerging markets in Southeast Asia, and it's become a gold standard. I would say many would agree with me that for a developing country in the region. We have at the moment about 32 million population, and as many of those of you who are familiar with Malaysia will know that English is widely spoken and Malay is our national language. Mandarin is also widely spoken. That's the benefit of having such a skilled talent pool, the opportunity to use Malaysia as a hub for the region, especially if those who want to trade with China. Then we move on to, in terms of skilled talent pool, to follow on, we have a skilled talent pool, most people speak English, and a continuous government effort to upgrade talent. Even in current situations, we are looking at ways to upgrade our talent, reskill our talent to be relevant to the market. Strong focus has always been in the last number of years on digital infrastructure and transformation, even so important today, considering the impact of COVID-19 and the restriction orders that we are facing. Then we also like to share that, Malaysia, those of you are familiar, we started with an agriculture kind of environment, economy, now moving then into a manufacturing, and now moving to more service, knowledge, and innovative-based economy. We always tell, our investors, trade exporters, that Malaysia is in good positioning as your gateway to ASEAN. Next slide, please. Why Malaysia? I will not dwell too much on this. Vibrant business economy, very close affinity with British, as we are part of the UK Commonwealth. supportive government policies, educated workforce, and a developed infrastructure. Move on, please. Okay, how has Malaysia been coping? Many of you would be familiar, and those of you who are not, are still wondering how Malaysia is coping. I think today we are speaking on a very good topic where Malaysia has been recognized that we have coped with the impact very well. Congratulations to our people in the medical sector and our frontliners who have, our Ministry of Health has been continuously updating, has taken measures, advising the government. We have taken a 5-phase preventive measures, and currently we are at the 5th phase, I'll say, hopefully at the tail end of the movement control orders, or in Malaysia, we call it overall lockdown. It's not a complete lockdown, but restrictive with stringent SOPs. Currently, we are at the phase called conditional MCO. Tomorrow, we are expecting an announcement because the conditional MCO is supposed to end next week on the 9th of June. Most of the businesses are allowed to open, but in a restrictive conditions with strict SOPs, social distancing, initiatives in place. So impact similar to many countries and also our neighboring countries, travel restrictions are something that's still in place. In terms of the sectors have been affected, manufacturing, yes. Of course, health has been more positive. We'll hear more from our colleagues, our speakers shortly. Exports have declined. In terms of course, retail, there's an impact. Unemployment rate is projected to increase, but not drastically, perhaps from 3 to about 5%. However, in my next slide, I will show you, what the government has put in place to combat this impact. Of course, on a positive note, online sales for FMCG has increased. I was just listening to one of our government agencies session this morning, and it says that online e-commerce transactions business has gone up like nearly 200 to 300% during this last 2-3 months. Next slide, please. So just to quickly share, the government has taken proactive measures in terms of announcing stimulus packages, which have already been implemented, valued at 58 billion. That is about 18% of the GDP. They have also announced a recovery plan. We are hoping to hear more tomorrow. There will be an announcement. That is, next slide, please. So quickly, I will not go through because these slides will be circulated. These are some of the sectors, but today's focus in healthcare. So e-commerce has become big. Digital is definitely, even in healthcare, I think our colleagues will share later, anything to do with, in terms of, we are talking about medical devices today, but, anything related to technology is definitely in demand. So technology, energy, advanced manufacturing, healthcare, as we will speak more later. Next slide, please. Education, always a demand. Again, in terms of e-learning, train the trainers for teachers as we move into online e-learning. Food and drinks and retail and infrastructure. Of course, it's slowed down, but in long term, there will be opportunities. So I would just like to move on quickly. So that is just to set an overview of the opportunities for UK companies in Malaysia, where we are in terms of short term and the medium term, and of course long term. And this is just to share in terms of a diverse blend of UK companies, a well-established presence in Malaysia because of the long-term business partnership between UK and Malaysia. Next slide. Okay, so what is the role of the BMCC in all this? BMCC has, we do have members online, so you will be familiar. Of course, like in any chamber, the chamber, BMCC is of course known for networking, business, B2B engagement. But during this MCO period or the COVID-19 season, or I'll say impact, we have seen more and more companies approaching us for advocacy, in terms of be it on mostly on sector based. So BMCC facilitates through our members committees to reach out to government agencies. What are the issues being faced by our members? And we facilitate to address some of these issues. The second area that has become more prominent, because you can't do business through conventional ways, branding and exposure has become very important. So we have been working very closely in our members to talk to address how can we position our members in various ways to brand and position our members in the market. And last but not least, the very important, we are a bilateral trade organization. So trade and market entry services for UK businesses is key. We also support our members' entry into the UK. So this webinar is part of the trade services that we provide. Next slide, please. So very quickly, in terms of trade and market entry services, currently we are open to do virtual, business matching. That's the new way of doing business today. Businesses in Malaysia continue to be active, work from home to virtual, and more people are getting used to working from home. We're doing businesses, doing online meetings, online roundtables, online session, online presentations. So that is something that it's something that UK companies should know, that Malaysia is open for business. In terms of market entry, we provide a tailored market research report, event management services, and also trade missions. Again, here we are looking at virtual trade missions, and since physically it will not be in the short term, we could do that. Next slide, please. So this is my last slide, just to share that some of the collaterals, some of the things that, for UK companies, especially if you're keen to know more about Malaysia, more about today's session, we have, the publications available. We are running this webinar series. We also have a catalog of list of expertise available within our membership to support UK companies set up in Malaysia or do business in Malaysia. And an advice during this period is that do reach out to us. Reach out to the chamber or our partner. We are an official delivery partner for the Department for International Trade if you're very keen to know more about Malaysia before going to anyone else. So with that, I'll just move on to the next slide. Okay, just to share also that BMCC is part of the BCR network. So if you're reaching out to us, we will also be able to connect you to our network of chambers, not just in ASEAN, but through our affiliation with the British Chamber of Commerce, especially those in the ASEAN region. If you'd like to reach out to to the UK side, and those audience in Malaysia, who like to reach out to UK side. Okay, next slide, please. Okay, with that, just a quick overview about Malaysia and the chamber, the role of chamber plays in Malaysia. So if you're keen, do contact us. We are a small team in the trade side. This is my team in the trade side. This presentation will be shared to everyone, so you can get our contacts. So with that, thank you very much for your attention, and I'll pass it back to Samantha.
Thank you very much, Jennifer. Now we have engineer SASIKALA DEVI on the session.
A very good morning for the participants from European region, and a very good afternoon for those from Malaysia and the Southeast Asia region. Yeah, I would like to briefly take you all through the regulatory activities, especially focusing on the activities during this COVID-19 pandemic. Yeah, next slide, please. I will introduce the Medical Device Authority and take you all through the medical device regulatory requirement in Malaysia, focusing on registration and licensing, and some updates on the medical device regulatory requirements and services provided, especially during this conditional movement control order that we are facing right now. And finally, or to take you all through the exemption order, which is meant to assist the industry to bring in devices during the emergency route. Yeah. Okay, next slide, please. Okay, just an introduction to those who are not familiar with Medical Device Authority. It is a statutory body established under the Ministry of Health based on the Act 738 on the 14th of June 2012. And the main function of MDA is to control and regulate the medical devices, the industry, and all the activities related to medical devices. Yeah, and then we have another Act, Act 737. To regulate the medical device industry and provide the matters connected thereto. Yeah? And we have a regulation.
Sorry, I think Sasikala's connection. Hello, Sasikala, can you hear us?
I can hear you. Yeah, I can hear you.
Okay.
Hello, can you hear me?
Yes, yes.
Okay, can you move on to the next slide, please? Okay, as I mentioned earlier, we have two acts. So we have Act 737 and 738. And both these acts gives the powers to the minister, to the Medical Device Authority, the chief executive and the officers in MDA to regulate the establishment dealing with medical devices, the users, meaning the healthcare institution, and also the CAB, so the conformity assessment bodies. Next slide, please. Okay, these are the two main activities that we regulate in Malaysia. One is the registration of medical devices. No medical device shall be imported, exported, or placed in the Malaysian market unless it's registered, and that is a penalty to it. And until today, we have registered more than 580,000 medical devices in Malaysia. And the next regulatory requirement is the requirement of for establishment license. No establishment shall import, export, or place medical devices in Malaysia unless it holds a license. Yeah, and we have licensed more than 2,300 establishment. And if you look at the number of authorized representative, it covers more than 60%, and the local manufacturers covers about 14.7%. There are about 356 manufacturers licensed with MDA, Medical Device Authority. Next slide, please. Okay, this is the very simplified flow, how a product is registered in Malaysia and who registers this. The establishment, the authorized representative, AR meaning authorized representative, meaning to say they are the authorized personnel, authorized company dealing with medical devices that are imported from foreign countries. So the authorized representative and the manufacturers are the ones who register the product. And the requirement for registration, there are 4 elements here in the second box. It's the DOC, which is the declaration of conformity by the manufacturer or by the manufacturer. Second is the quality management system. We ensure that all products that is placed or registered in Malaysia must comply with the quality management system for manufacturing, which is ISO 13485. And CSDT is the Common Submission Dossier Template, which is equivalent to the STAT in EU. This is a documentation, technical documentation that needs to be submitted. And of course, on the PMS is a post-market system. So with all this documentation, they have to engage the conformity assessment bodies. We call it the CABs. CABs are also equivalent to the notified body in EU. And until today, we have about 21 conformity assessment bodies registered with Malaysia. Okay, so the CABs, in short, they will assess the quality management system documentation, the CSDT or the technical documentation, the post-market surveillance and vigilance document, and of course on the declaration of conformity. And they will prepare a report and submit to the establishment. And the CAB report has to be uploaded together with the other documentation on MDA's online registration system. We call it MEDCAST. It's an online registration requirement. Yeah, together with the application form, the 4 elements, the document of declaration, and post-market surveillance system, quality management system, and the technical documentation. Once it's uploaded on the MEDCAST system, the Medical Device Authority personnel will look into the registration requirement and also the compliance to the regulation, and we impose a fee and the product will be registered. And only upon registration, the product can be placed in the market, meaning to say can be placed in the Malaysian market. Next slide, please. Next slide. Next, a previous slide before this, yeah, that is on, okay, this is on as licensing of establishment. As I mentioned earlier, all the establishment dealing with medical devices must be licensed with Medical Device Authority. The four main organizations, we call it the authorized representative. These are the representative from foreign manufacturers. And manufacturers, local manufacturers, distributors, and importers must be licensed. What is the process of applying for the license? It is an online application. One, the 2 quality management requirements. For the manufacturers, they must have compliance to ISO 13485, and authorized representative, the distributors and importers must have GDP-MD, is a good distribution practice for medical devices. And the certification for the ISO, for the quality management system will be assessed by the CAB. And with the certification, the establishment, all the 4 establishment will need to apply online on our MEDCAST system with the reports, the certification from the CABs, all the documentation on the quality management system, the authorization letter. For example, if they are authorized representative, they need to attach the authorization letter from the foreign manufacturers, and the distributors need to submit the authorization letter from the authorized representative, and also the importers likewise. And the list of medical device they're dealing with here. Once it's uploaded, Medical Device Authority will review and assess the application, which is to ensure it is in compliance with the Act 737, and it will be a license. Yeah? And if there is a need, MDA, Medical Device Authority, will undertake any audit, or we call it the inspection of the establishment, if there is a need. Yeah, next slide, please. Previous one, yeah. Okay, some of the updates activities that we are focusing during the COVID-19. One is the approval of medical devices through special access with notification requirement. That is the main activity that we have to assist the organization to bring in medical devices through the special access. And we have an order in 2016 that allows products such as the test kits, diagnostic test kits for the COVID-19, some ventilators, and a lot of other products to be brought in through the special access. Later, I will show you all the process of application. Second is the guidance. During this emergency outbreak, we have numerous guidance documents to assist the industry and assist the healthcare institution to comply with the regulatory requirement. And then we have set up numerous expert committees to assess the medical devices for special access, because Malaysians and also throughout the world, there are a lot of innovative industries coming up with innovative devices, and it's not been registered before in any countries. So we have these issues of assessment. So we have numerous committees. The experts are from the Ministry of Health, from the industry, they are also from the higher education. They are formed to assist MDA to assess the medical devices. Then we have these, we call it the MICC, Medical Device Authority Industry Consultative Committee, where the association, the Local Medical Device Association, we have numerous discussion as it is from the MCOs right until the conditional MCOs. We have online discussion to assist the industries. And then we have consultations sessions. We have online consultation just to cater for the current situation, and our officers are working 5 days a week to assist the industries on consultation. Next slide, please. Okay, these are some of the services provided by MDA, especially to assist the industry. Of course, the registration process is ongoing. We don't want any kind of delay in the registration process, and the change of notification is also ongoing. This is to ensure the products that has been registered. If there is any kind of amendments to the product registration, this process is also ongoing. And establishment license, establishment license is also ongoing. The application and the approval is still going on without any kind of disruption. We have, as I mentioned earlier, we have about 21 conformity assessment bodies to assist in the assessment. And of course, we have an enforcement team to ensure products only registered and also been approved by MDA is placed in the Malaysian market. Enforcement is ongoing. And consultation session, and we have online consultation is ongoing, and we have online consultation, and our officers are willing to assist the industries with numerous issues. And then we have certificate of free sales to assist the industries to export the product, and coming to the special access to bring in products during the emergency situation. And if there is any kind of feedbacks or complaints, you can also go online and on our website, mda.gov.my. We have a special feedback complaint emails. Next slide, please. Okay, now coming to focus on the Medical Device Exemption Order 2016, we use this order to assist organization, especially the healthcare institution, to bring in the device. So number one is for personal use. This just an overview of the order. Then I'll focus on the special access. So products meant for personal use is exempted, completely exempted. You don't have to notify us. Products brought in for demonstration, for marketing, education, clinical research, and custom made and special access. It have to be notified. MDA has to be notified. The manufacturer or importer is exempted from registration of medical devices, exempted from establishment license, but shall notify the authority in writing of the exemption. So this is very important. even during this pandemic outbreak, the products that's brought into Malaysia and placed in the market has been assessed by MDA, and a letter of notification is given to this establishment. Next slide, please. Okay, now coming to the details now, how to apply for special access. The number of industries, organization, healthcare institution, individual organization, interested in bringing in devices into Malaysia and also for exportation. But I'm going to focus on how to apply for special access, the notification process as it is here. So the main thing is medical device, import and supply of medical device for special access. There must be a demand. For example, the demand identified by the healthcare institution, which means to say the healthcare institution will request for test kits, or the request for ventilators, or even x-rays and other devices. So the importation is based on demand during the pandemic outbreak. Yeah. So what are the products that can be brought in? The products imported, and for product also manufactured. Yeah. And also product for true donation. A number of products are being donated, but any kind of donation must apply for special access. So there are 4 routes here. One is the product that has been placed in the 5 major developing countries and also been approved by WHO. That is the first route. The second route is for products that has been brought in from other countries that has got no registration or no approval. Yeah. And the third is the route for products manufactured locally in Malaysia, and the fourth is donation. Okay. And any one of these 4 routes, the applicant has to submit a form which is available online, yeah, to request for notification for the products they're bringing in through special access. And once the application has been submitted through the email specialssa.cocm at mda.gov.my, and MDA will issue an acknowledgement for the application, not for bringing in the device yet. And the team will verify the documentation. And as I mentioned earlier, we have numerous special access committees, and this is one of the assessment by expert advisory committee, and this consists of the expert from the Malaysian National Lab, and also from the Institute for Medical Research, or we call it IMR Malaysia, and experts from the higher education or institution, and also from MDA. So this committee will assess, and if there is a need to further verify, and it will go through whether the device, the documentation that they have submitted is not comprehensive, then they have to do further testing with the we call it IMR, yeah, Institute for Medical Research, yeah, and then it is processed, and there is a minimum payment of 300 ringgit, and finally there will be an issuance of special access letter. Okay, next slide, please. To assist the industry, we have documents. Yeah, one document is meant for ventilators, and the second one is meant for the special access that we have made some updates. Yeah. So coming to the condition here, after applying for the notification, please bear in mind the condition of notification. So the companies that, because the registration and licensing is exempted, but please bear in mind the condition of this notification. The applicant shall be fully responsible for handling the medical devices during the period of special access, including use only in accordance with the purpose as declared in the notification submission. Yeah, so it's very important the applicant comply with this condition. Second, ensure proper handling of the medical devices. Third, advertisement is completely not allowed. Advertisement of this product brought in through special access, because in our Act 737 Section 44, it clearly says only products registered is allowed to register, allowed to advertise. The products that is brought in by special access is not registered product. It is only a special access meant to cater for the needs and the demand during the emergency. So I do hope all the industries or any individual organization bringing in, please bear in mind they should know there shouldn't be any kind of advertisement of the products brought in by special access. And fourth, comply with any direction issued by the authority from time to time. Please visit our website, mda.gov.my, then keep all the information to the, pertaining to the medical device at the premises, and shall be made available upon request by the authority. So any documentation, please keep all the information, yeah? Responsible to comply with the requirements of post-market surveillance and vigilance, yeah? This is clearly mentioned in Act 737. Yeah, the responsibility of the person who is placing the device in the market, especially during the special access, you have to be responsible for post-market surveillance and vigilance. If there is any adverse event, you have to report. It's mandatory to report to the authority and take the necessary action to ensure the product is safe, yeah, that the product brought in through special access. Ensure the labeling is sufficient to ensure safety and performance of the medical device. Ensure the use and storage of medical device in according to the manufacturer's requirement. And the applicant shall be responsible for establishment and implementing a system to monitor safety and performance of the medical device. This is very important. The organization is bringing in must have a distribution record. This is to ensure traceability. And going on, yeah, moving on, the local manufacturers, they have a lot of manufacturers manufacturing devices, even ventilators, yeah. So they have got this responsibility, yeah, to ensure that the manufacturing requirement, the QMS, quality management requirement, we have given a waiver, yeah, within 1 year period, they must have this quality management system in place. For example, the ventilators are manufactured and placed in the market. Is the lifespan of a ventilator is about 7 years. So the responsibility of the person who's bringing the device during the notification, during the emergency, must ensure that they have quality management system, yeah, the manufacturers. And of course, they have to comply with the guidance document, and on the active device, you have to ensure the proper installation and testing is carried out. Yeah, and next page, please. Okay, that's the summary on focusing on the notification of medical devices through special access during pandemic. Yeah.
Okay, so thank you very much, SASIKALA, for the insightful session on the MDA Malaysia. Once again, if you have any questions, kindly submit it through the Q&A function at the bottom of your screen. And now I would like to pass this session over to Gertrude.
Thanks, Samantha. Good afternoon to our Malaysian delegates, and also good morning to UK's colleagues and also delegates as well. So I'm going to talk about in terms of how COVID-19 pivots Malaysian healthcare industry. Next slide. So basically, the contents of my talk will cover in terms of the market size of Malaysia, looking at Malaysia healthcare. What do we have done in terms of covering the COVID-19 in some Malaysian healthcare situations, and what does it impact in terms of our healthcare situations? What are the risks and opportunity that can take into consideration next? And what are some of the services that DKSH as a service provider that we are providing in Malaysia and also in Asia as well? Next slide. So as an overview in terms of Malaysia, as we all know that Malaysia have a population of 32.37 million. And looking at the GDP growth right now, with the current forecast of the COVID pandemic seasons, our Bank Negara have announced last month, our GDP growth is expected to be negative 0.2% to 0.5%, depending on how we recover for the second half of the year. And the consumer price index, as published in the kind of national website, is 117.6, which shows that negative 2.9% drop versus last year. And USD exchange rates is hovering around 4.3 to 4.3 plus. Looking in terms of the total healthcare market expenditure forecast, and this is forecasted as based on the Fish Solutions research. It is based mainly actually talking about 67.9 billion ringgit in year 2020, and that still demonstrate about 8% compared to last year. And looking in terms of Malaysian healthcare tourism, our expectation and also forecast at the beginning of the year is 2 billion in year 2020 versus last year is approximately about 1.8 billion. And Malaysian healthcare tourism plays a very important role in contributing to our economy as well. Health Ministry allocation in terms of funding this year, based on the report from the pharma and also from the kind of like local Ministry of Health, basically we are actually budgeting 30.6 billion ringgit, and that's approximately about 7% growth compared to last year. And in addition to this, our government actually have pumped in 600 million to tackle in terms of COVID-19 situation in the Malaysian healthcare as well. Next slide. So just a capture in terms of the macroeconomy again, what will be the main disease that concern in terms of Malaysia, and also what will be the high prevalence rate for certain disease. And we can see here the reported data looking at 5 principal causes of death in Malaysia, looking at different disease, excluding the transport accidents. We're looking at in terms of heart disease, pneumonia, cerebral vascular disease, chronic level respiratory disease. Those are the 4 main common diseases causing the mortality rate in Malaysia. And aside from that, the most prevalence rates high in terms of Malaysia will be diabetic. Currently right now, our Malaysia, 1 out of 5 Malaysians will have a diabetic cases. And we projected by year 2025, our diabetic rate is increasing from 20 to 31.3%. And looking in terms of cancer prevalence rate, the common cancer, the top 3 cancer will be breast cancer, lung cancer, and colorectal. And looking in terms of the number of cancer, which is reported in the global count, is very high as well. And the third major kind of like disease that concern will be the chronic kidney disease, whereby government actually funding a lot for these treatments in terms of kidney disease. And we are expected by year 2020, which is this year, the end stage of kidney disease approximately about 51,000 of patients. And this is a lifelong disease. And this number will growing double in 2040. Aside from that, as we all know that at this COVID pandemic seasons, the kind of mental health become a concern. Apparently right now, looking in terms of mental disorder for the adult patients above 16 years old, is already very high at 29.2%. And with these seasons right now, this has become a concern and become more kind of like disease to look at or to tackle on in the next few months. Next slide, please. So what is the size in terms of Malaysia healthcare? And this is the reported data from the IQVIA for 2019. And basically, if you look at in terms of the size of Malaysia healthcare, as reported, is approximately about 8.2 billion. And out of this number is, we can see here, majority of the kind of like sales is contributed from the ethical status of the products. And subsequently by OTC, which represent approximately about 20%, last but not least, looking at in terms of pharmacy products. And obviously looking at in terms of the growth, whether it's private or also government, both segments actually register in terms of the healthy growth versus the last year of 2018. And looking in terms of sub-channel, and sub-channel here excluding others here, we can actually see that whether it's a medical channel or pharmacy channel, there is a register in terms of the positive sales growth versus 2018. And looking at the different therapeutic high priority for Malaysia, basically you can see that cardiovascular and metabolic represent the first two priority in terms of the products, and subsequently follow on with anti-infective products. Next slide. So what have Malaysia done in terms of curbing the COVID-19 pandemic? So next slide. So these are actually summarizing in terms of 10 major things that we have done in Malaysia to curb the COVID-19 situation. Number one, so our government have introduced in terms of MCO or CMCO starting from March 18 and expected to be lifted by June 9th. And the other one, the government have introduced 280 billion ringgit in terms of stimulus package to support the kind of like citizen as well as industry to go through this pandemic seasons. And at the same time, the third one, I think it's a famous one, is that we are all waiting in terms of reports from our kind of governments daily, which to understand the kind of situation of our country for Director General of Health. And in DKSH part, we also send our kind of like updates to our client as well. Despite from that, there's others such as like WhatsApp, the kind of like PPE support from our local designers. So these are the all snapshot in terms of what we have done for Malaysia to curb this COVID pandemic seasons right now. Next slide. So what is the impact in COVID-19 in the Malaysia healthcare? So next slide. From these trends, basically is the kind of like sales trends that we actually took from our DKSH internal data. And just a kind of like sharing is that DKSH, we are the service providers. So we do have different healthcare industry partners and companies with us doing W&D warehouse and distributions, plus outsourced commercial. So with that, we have our own insights of data that we have from the different products and different category of in the industry of the healthcare itself. So basically looking at in terms of total sales, we actually see kind of like slight decrease in terms of the sales by during this season of the COVID pandemic of this year, March, taking into consideration March to May sales versus the kind of sales at the same duration of time in 2019. So we can see that whether it's looking at in terms of total sales, pharma or OTC or medical device across the board, we actually experienced a lot slower sales compared to last year in 2019. Despite we in our kind of like in-house services, despite we are actually engaging the kind of stakeholders through face-to-face meeting, we also do a lot of omni-channel kind of promotion and also services as well, such as webinar, telesales, and so on. And this is mainly due to the kind of like number one is due to because of the lockdown, the face-to-face engagement, the patient visits to the hospital using the hospital facilities actually decreasing as well. And based on the recent external published report in Malaysia, in terms of patients visiting private hospitals decreased approximately more than 60 to 70% in the hospital itself, and in the clinics approximately about 50%. For some of the states, because of the restriction in terms of traveling, and the majority of the patients is actually come from the other country as well, we definitely with these seasons, the patients will not be able to come to Malaysia for the kind of follow-up and visits. And this definitely caused the kind of like patients drop significantly in those hospitals that focusing in terms of overseas patient. And what we can see here is that, for example, like Klang Valley, Malacca, and also Penang, those are the states that we see that healthcare tourism plays a very important role. Next slide. So looking at in terms of channel point of view, so from these slides, we actually look at in terms of total sales, we divided by channel, pharmacy channel, clinic channel, private hospital, and also public hospital. So with the kind of like limitations or the patient visits the hospitals, definitely private hospitals and also clinics, the sales is actually decreasing. However, looking at in terms of public hospitals, we can see that based on our sales data, the kind of sales in the public hospitals is actually decreasing, and approximately about 10%. And why is that so? Yeah, I think majority of the kind of like patients, as we know that in this COVID seasons, some governments have actually assigned certain hospitals become a center of excellence for screening and also for the kind of like treatment as well. With that, a lot of patients have been referred to the government hospital, regardless of whether they are positive, tested positive, or they are suspected cases in terms of having symptoms. So that's why the public hospital patient is actually getting increased, and majority of them has been treated with different type of medication. That's why. Sorry. So we can see that there's an increasing in terms of the sales in the public hospital versus the other channel. But of course, in the pharmacy channel, we also see that there is a slight decrease in terms of sales. And that could be because retail pharmacy facing a lot of strong competition from supermarkets, whereby some of the products, particularly for personal care products, they will be overlapping in terms of the products availability in the supermarket versus in terms of retail pharmacy. And at this season, whereby the economy stability is not there, price will become a kind of like major consideration when the consumer actually choose the product as well. So next slide. So as a summary, so economic fluctuations, low daily activities, employment disruptions leads to the lower buying power and also lower sales to the company. I think we actually seen a definitely significant decrease in terms of face-to-face interactions with the healthcare providers as well as the patients pool using the hospital facility. High number of patients treated with the COVID treatment hospital resulted limitations in terms of bed in the hospitals. At the same time, also increased the kind of like usage of the medication in the private hospital as well. High demand for the disinfected products, personal care, protection products such as PPE, masks, and gloves, vitamins, respiratory products, and chronic disease medications have gone out during the season. Delay fulfillment of the products to hospital center, especially for the cold chain, because there are some of the area which is prone to the disease has been locked down by our government from time to time. We also seen that there's a reducing in terms of flights frequency, and which caused that instability in terms of supply chain of the medication itself as well. Next slide. So what will be the risk opportunity in the kind of situation presented to us right now? So below, the next slides will give us some considerations for you to think about or to ponder on in terms of how can we actually leverage these situations to do better with the post-COVID pandemic sessions. Can we just press enter? Yeah. Number one will be instability of economy and also commercial business. Well, that will be the situation in terms of challenges. However, we know that there's a high prevalence, particularly for mortality rates kind of like disease, which is cardiovascular, diabetic, and also others. And we understand that looking in terms of Malaysian government, they are still prioritized in terms of certain diseases like mental health, oncology, diabetes, kidney. So those are the things that is still a major priority for the government as well. And also for medical devices, our governments have pumped a lot of money in terms of improving infrastructure and also technology in terms of treating the patient. So what will be the opportunity arise? Let's prioritize in terms of the key products, focus in terms of product innovations, especially for medical devices product, because different product, can be actually developed at the easiest time compared to pharma product. Leveraging collaboration in terms of other services, like what sort of products that the company actually can do their own, and how do we leverage in terms of other partners to market the products or to commercialize the products more effectively. Second consideration is that we know that with these COVID things, it's actually forced the way of how we interact with each other, whether to the HCP and also to the patients. However, nevertheless, we understand there is an increase in terms of technology adoptions and also digitalizations among the HCP and also the patients. And one of the possible way is that consideration is that how do we resonate our digital technology to increase or to leverage in terms of different touch point more effectively. Like what we are doing today is that engaging through the kind of webinar session to do the education and also sharing purposes. And moving forward, maybe face-to-face promotions need to be taken into consideration, because today there is the most expensive touch points for a lot of companies. And to think about how do we leverage in terms of telesales and also the other technology channel again. Shorten shift of the patient flow, private to public. We know that at this moment right now, number of patients stepping into the private has become limited. And that could be because of the few reasons. Number one is because of the lockdown of the reduction in terms of movement. Number two is because of the economy instability, employment instability, causing the kind of like purchasing power becomes limited. So that's where we actually experience that the patient's flow, if they do not get a special kind of treatment in the private hospitals, they might land up in the public hospitals, especially at this moment. Probably it will recover later, but definitely this has been affected right now. So we can actually leverage in terms of how do we differentiate the services between the kind of like the company can partner on with the private hospitals, and more demand of the certain product in the government hospitals because of the supporting additional funding. Obviously, that would actually help in terms of to create more opportunity for the company. But so what can we do is that maybe we can partner with the company can partner with the private hospitals to provide a more meaningful services, like for example, consultations through phone, or the kind of like offering patient support programs if they are actually dealing with the kind of like chronic disease medications. The fourth area that we actually see is that the stiff competitions between a retail pharmacy and also the kind of supermarkets. And these are the kind of areas that we need to think clearly in terms of like how do we differentiate the kind of target segments clearly for each channel, and understand in terms of the consumer behavior, where would they, which consumer that we want to actually take on in the pharmacy versus in terms of who do we want to take in the supermarkets. So we need to continue to leverage in terms of to understand the product segments better, and how do we actually probably in terms of taking into consideration to collaborate with the partners in with the different multi capabilities at the different SKU to target at the different segments. The last but not least, we know that with these restrictions, it causes movement kind of restriction at the same time. It also causes a lot of like changes towards the kind of like supply disruptions due to the logistic restrictions. So now with the kind of like we also seen that the products, the hospitals, whether today is private hospitals or government hospitals, they are offered the delivery service to ensure that to make sure that the patient receives the products on time. So probably another consideration for the company is to consider e-commerce if the product is a non-prescription item, or we can actually do in terms of patient direct delivery through the hospitals. Because today, aside from government to actually introduce a free delivery to the patient for the chronic disease medications up until June 2020 for free, there are some of the pharmacy and also private hospitals are offering these services to patients for free as well. So next slide. So basically the next slides. So the question is that how do we leverage in terms of maximize omni-channel the touch points? We know that in terms of from the company products, which is getting the innovations products to reach to the consumer, there is a multiple channels and touch points that we can actually leverage on, whether the company is doing directly or to partner with the other company to do certain services as well. So in actual fact, with these seasons, I mean, it pushed technology to one step further, and it pushed whether it's towards the healthcare providers, the industry, or the patients to think in a different way and to go against the norm in terms of having a face-to-face engagement more rather than, I mean, to probably need to think about in terms of using the digital more. So in this manner, we know that face-to-face is one of the conversational promotion tools that we'll be leveraging on. But how do we actually look at in terms of maximizing the telesales, the digital part, leveraging in terms of all the platforms that we have. And in today Malaysia, we have various platforms, whether today in terms of e-consultations, doctors getting the doctors to visit the patients through the mobile, the kind of like diagnosis through the WhatsApp or applications. So everything can to be done without through the face-to-face interactions and can be done in the digital manner. So the question is that how do we leverage in terms of omni-channel and also touch point to maximize our kind of engagement with the patients accordingly. So next slide. So I just want to share with you, these are the services that we provide in DKSH. So in DKSH, we are a service provider company. We provide various kind of services, whether today is warehouse and distributions, or whether today is outsourced commercial or value-added services. And in terms of value-added services, the kind of like main thing right now we're looking at is the telesales and also telemarketing, patient solution programs, and e-commerce, which is the digital solution. This will help to tackle in terms of some of the kind of like needs for the industry and also the company to reach out to the HCP and also to the patients in a more effective manner. With that, I conclude my sessions. Thank you very much for your attention.
Thank you very much, Gertrude. Okay. So due to the limited time that we have, we will try to answer as many questions as we can. Okay, so starting with Puan SASIKALA, there's a question for you from Nicole. Is the special access application route available for notifying the medical device part of drug medical device combination products, or is the special access route only applicable for pure medical devices?
Okay, medical for special access is applicable for any medical devices that need to be brought in during the emergency situation like what Malaysia is facing right now. It is not limited to IVDs. It's also open to any general medical device or combinational product. Any devices, but there must be a demand from the healthcare institution. Okay, I hope that answers the question.
Okay, so the other question would be, do you think, from Tim, do you think SA consideration would include medical recycling equipment capable of recovering potentially infected single-use disposable plastic material used in hospitals? Items such as disposable single-use plastic ward, bed, and cubicle curtains, as well as operating theatre, medical tray wraps, and drips.
Can you repeat the question? Is it on the chat?
Yes, it's on the chat.
Sorry. Okay, let me read the question because I find my chat is all cleared. I have some problem.
So,
is it
sorry?
Yeah. Can you repeat the question?
Okay. So, do you think SA consideration would include medical recycling equipment or of recovering potentially infected single-use disposable plastic materials in hospitals?
Okay, if it is not a medical devices, like plastic materials are not medical devices. Yeah, but bed is a medical device. Yeah, so bed can be brought in if there is a need through a special access when there is a demand. So the cutoff point is it has to be a medical device. Yeah, I hope that answers. There was another question on sanitizer. Sanitizer is not a medical device. It is already controlled under the National Pharmaceutical Regulatory Authority. Yeah, I hope that answers the questions.
Okay.
We only control special, we only control finished products, not materials. Okay, I hope that answers the question.
Okay, so there's this other question from Kogila. So Malaysia was once a lead in e-health, but the policy was later abandoned. So will there be a revival of e-health and investments into digital healthcare, including for digital healthcare education?
Is it focused to me or to on e-health, Samantha?
This one is for, yeah.
So maybe I'll try to contribute to that on e-healthcare in terms of the current situation, and even prior to the current situation, it has been noted that the e-healthcare is getting to a demand, and this is we recognize that it is also a strength among UK service providers. So some of these areas that I've noted is that, for example, remote monitoring of patients, systems, especially in current situation, systems to monitor employee healthcare. So, again, I just like to share that, considering the current situation, the demand for e-healthcare is definitely a rise. There are, we believe that there is a demand for it. But in terms of investments, we still need to wait and see. If you're asking if it's a government investment, we still need to wait and see, when budgets come out end of this year, the focus of the government on this. But digital is definitely a priority for Malaysia. I hope that answers the question.
Okay, thank you, Jennifer.
Maybe Gertrude, you would like to share something?
Yeah, maybe I just add on. So what happened is that, like I mentioned just now, is that government looking at in terms of e-healthcare, I think there will be different angle, yeah. Number one is talking about patients delivery. Number two is that, as far as I know, it's also including the database in terms of how do we in terms of patient database, whereby government also spends some punch into it to improvise this as well, which they have parted it yearly under the kind of like budget for the healthcare. So talking about in terms of patients delivery, our government has started to kind of like to give all the chronic disease follow-up patients free delivery of the kind of medications for 3 months, starting the month of April, and it will continue on until June 2020. That is as of right now. And there's another kind of like another partnership whereby government hospital, which is Hospital Putrajaya, they are actually partner with Post Laju, our national courier, to provide the medications for free for the patient as well. So those are the things that we constantly to see. And the other thing is that I suppose that, in terms of for healthcare services, they also requires a lot of updates, right? Whether from international level or regional level. But today, with these COVID pandemic sessions, they will not be able to run this seminar or attend these conferences through face-to-face. So what happened is that a lot of meeting right now is done through the basis as well, e-education as well. So for example, like international meeting, ASCO, or the kind of like, other cardiovascular meeting, all done in e-commerce rather than or e-platform, rather than in terms of face-to-face engagement. So we are embarking into it, and there's different areas that we are talking about.
You're muted.
Can you hear me?
Sorry. Thank you very much, Gertrude. Okay, so we'd like to close the session and thank our speakers SASIKALA from MDA Malaysia and Gertrude from DKSH for providing clarifications on the outlook and the impact of COVID-19 on the Malaysian healthcare industry. Thank you all for a very excellent session and support. So we shall meet again next for an upcoming event. BMCC will be having a webinar on post-crisis business landscape. How do we navigate it through? This will be happening on the 19th of June. Thank you to all of our participants. Stay safe and stay healthy.
Thank you.
Thank you very much. Bye-bye.
Thank you. Bye-bye.